All right, hello everyone. My name is Seth Watson, and we're excited to welcome you to this YouTube Live Q&A with the expert himself, David Lott. Before we get really started, I wanted to tell you that our goal today is to add as much value as possible to you. So that I'm going to thank our sponsors. Is it Oscar?
The Oscar and Shirley Lott Foundation.
Yeah,
we would thank them for their lifelong commitment to my education and also like working in the clinic, fixing equipment, things like that. So
that was a good sponsorship.
Yeah, that was sponsorship for that.
But talk about a little bit. So you talk about posture and how that is such a major contributor to headaches and neck pain. So tell me, let's just make it practical. So someone that is still working, okay, let's think about what would be the positions that can commonly put them in that situation where they're going to start having, they're more likely to have headaches and neck pain.
I mean, it's like your dental hygienists that are in a position here all day. They're going to create some very habitual positioning that over time could potentially lead to mobility restrictions and headaches and things like that. You got your people in the office that are on their computer that their monitors may be a little bit too high or too low. It's like there's so many little variations that, after you've done this for a long time, when I walk into my dental hygienist the other day, I was cleaning my teeth and she mentioned, oh, my shoulder's bad, I need to come see you. And I'm thinking, I can just see the way you're sitting right now doing this. And I know you do this with every patient. I can tell that your position and posture, when you do this 6 to 8 hours a day, you create adaptive shortening in certain areas and overactivation of muscles in some areas. And it sounds complex, but it's really not. It's like the analogy we were just talking earlier before we started visiting about a piece of plywood. I love analogies. I like stories because I realize patients don't care about fancy words and hearing how smart we think we are. Because I've been doing this for almost 30 years. I learn stuff new every year, or every day about different ways to do stuff. So we think we're a lot smarter sometimes than we are, but what I realize is that it's so simple, some of the things that are causing our neck pain. And it's usually just being aware of the things that you're doing in a very consistent manner and position, and then just doing a little bit of the opposite movements. It's like literally the hygienist that's having neck pain and shoulder pain. She's just been going on for years. I'm like, okay, well, let's raise your arm up. She's like this. I said, well, pull your shoulder blade back. And so I showed her 2 exercises just to have her pull her shoulder blade back. And I said, now do it. And she's thinks it's something crazy happened. Well, all I did was just teach her how to get back in her neutral position. So we work out of I hate to use the word alignment because that is misused by some professions, but we're not really, it's that our body gets used to using it in a non-optimal position, I would say.
So let's think about the person who's sitting. I mean, unfortunately, since COVID's happened, a lot of people are sitting at the desk, and that's unfortunately what is a big contributor to many of our patients that are having neck pain.
Yeah.
So take us through what would be best practice from a positioning standpoint.
So think about a trailer. I'm going to use another analogy here. If you balance a trailer and you have your load in the middle, it pulls real easy. If you put your weight in the front, your truck's buried down. If you put it too far in the back, you're fishtailing all over. So when you're sitting at your computer, if I have my head forward and my arms are forward and my keyboard's out too far, I have my center of gravity, I've got a lot of weight forward, which means all the muscles in the back are having to work really hard. And you do that for several hours a day, you're going to have tension in your shoulders, your upper traps. You're going to have some occipital pain, which is that little pain here that leads to your tension headaches. You're also, if you're wearing bifocals and your screen's too low or too high, you're having to focus and you're in this extension. There's just a lot of stuff happening. And most of the people who are watching that are probably really good at their job. So you see details, we see the details. And so that's why I really love headaches. I like neck pain because it can be so simple to just watch somebody move. We've done this before. We'll have people at their work, have their coworkers video them in their workstation. If I did this the other day at the hospital. One of my patients works at the hospital. I knew that. So I just did a surprise visit to her office. I found out where she was. She was in the way back, the very back of the dungeons there. And I found her spot. I walk in. I'm like, I could automatically see why we're having some problems because her keyboard's too far out. She was using the mouse up here. It's a lot of simple things, but to answer your question, that's there's not really a perfect posture position, I think, for everybody.
Yeah.
But I think there's a more optimal way. And I think the other thing that we've learned as in physical therapy, we were taught, especially back in my day, way back in the day, like there's this perfect posture. You have to be perfectly lined up. Like that's good. There's an optimal way to be. But the key is like, I think any posture can be bad and any posture can be good. It's just you spend too much time in one position. I don't care how great it is, it's going to be uncomfortable. So it's a matter of moving. You know, if you're somebody who sits at your computer a long time and you're super focused, not like me because I have to get up and move around. But if you're somebody with that gift, then you might need timers. You might need to have a little 30-minute like phone goes off to help you just do some scapular retraction or some neck chin back, or maybe you just stand up and do a big stretch or something like that. Movement is the key. Like that's literally it. I think too, and you can interrupt me if we have questions, but I think, and I just had this conversation with a patient this week, I think it was, what is this? But so I'm really interested, like, why is it that someone who has a job, they're on their computer and they've had the same workstation for the last 5 or 10 years, right? And they've had no neck pain. And then all of a sudden we have neck pain. And then like, we're trying to fix everything. Like it's gotta be your computer, get a new desk, get a new chair. It's gotta be your bed. You need a new pillow. Like I gotta go, wait a minute, time out. So we maybe improve some of that stuff, but if you weren't having pain the last 5 years with that same pillow and that same bed and that same chair, like it's probably not those issues, would you say? I think what happens is we get out in the yard and maybe did pull some weeds or we got something stirred up. And then now those less than optimal postures kind of like expose and highlight, like they we're not as tolerant of them. Would you agree on that?
Yeah, I mean, once your muscles get aggravated, or that gets aggravated, your muscles tense up, and you stop moving.
So yeah,
our tendency is to just stop moving, and so that's one of the biggest contributing factors. Yeah. So that actually, one of the, it's like having a limp. A limp's normal for a week or two.
Yeah.
But if you keep limping for 1,
right.
2, 3 months,
now
that is not normal
compensatory patterns.
Yes, exactly.
That's when we have the knee. It's the ankle. Now it's the knee. Now it's the hip, and that's the interesting thing. And that's one thing I think why physical therapists have to become really good investigators, because most of what we see, like the pain that presents to our clinic, if it's a headache or shoulder pain, like it's not an acute injury. This didn't just happen. Like you didn't just like sprain your shoulder last week. How long has this been going on, Sally? Oh, about 6 months to a year, if they even know that. Like what happened? I don't know. So it's like you have to, and this is why I think that's probably one of the reasons I feel like that I've been successful, is because I'm so curious. Like you always kind of joke about how I'm asking why all the time. Like we don't just wake up with musculoskeletal pain. Something
and I
happens.
think that's a good, for anyone that's watching that is having neck pain headaches. You need to ask why. Why am I having neck pain headaches? Because we use the analogy all the time. It's like if a patient or if someone came to me and they just touched a hot stove and they burned their hand, I can help their hand get better.
Yeah.
But if they go home and touch the hot stove again, it doesn't make a difference, because they're just going to keep getting injured. And that's what oftentimes happens.
Yes.
When people deal with persistent headaches, persistent neck pain, is it's commonly because they keep touching the hot stove at home. And
healthcare providers don't do a very good job of asking those why questions. You go to the emergency room, you got blisters on your hand. Like the whole focus is put some Silvadene on it, wrap it up, whatever, infection. Like we're going to treat you and save your hand. But you're probably not getting a lot of education on, maybe somebody asked what you did, you may not even know. But if it's not just something that's on the top of your head of like why my neck hurts, like that's not really that important. Like the most important thing is we get X-ray, MRI, CT scan. Let's do a PET scan, because if you had, like I literally had a 15-year-old girl, this was several years ago, that had headaches that had been going on about 1.5 years. And so of course by the time she gets to me, she'd had PET scan, MRI, like all kinds of scans of her brain. They thought she had a tumor, like all kinds of stuff. And, I had the advantage of knowing that she doesn't have a tumor, right? And I would have never jumped to that conclusion anyway, because I'm so simply minded. Like I don't think of the worst case scenario first. Let's think of the simple. So she had all this test done. So everybody's like perplexed. Like we don't know what's going on. Neurosurgeons, like people a lot smarter than me, like had been involved. And so we got a question coming up. I'm going to finish this analogy real quick. And so what I simply did was sit down and found out when she had this headache, how long it had been going on. Her mom was there. We started talking about it. And I started kind of discussing, like I am right now, like a lot of like, here's what would lead to a 15-year-old girl having a headache. It's probably not a traumatic injury because there's no history, something positional. So this starts at 3, it starts at like 4 o'clock every evening. What is it that you do at 3 o'clock? I always ask patients, when you have pain that comes on, like ask yourself, what have you been doing for 30 minutes? That it's probably a positional thing unless you hit your hip with a hammer. Long story short, they had moved into a new house about that time frame. She was doing her homework. She'd get home from school, and instead of like the position that at the old house on her sofa, like she now did it at the bar. So she would sit at the bar and she would get in this position for an hour and a half to 2 hours every evening. And she started having these headaches at night. They would keep her from going to sleep. So I guess I saw her one time. She didn't have any more headaches. That's the part about asking those questions is when you help somebody, it's very rewarding, but you don't always get to find out. But I actually had to call and say, what's going on? Why didn't you come back? Well, she's like, oh, well, we figured out, you're right. It was that. And so I didn't have any more headaches. It was positional. It's like, but she spent tens of thousands of dollars of a lot of tests, which I'm not knocking that because you want to, if it's your kid, you want to make sure you rule out all that bad stuff. But it's usually simple. So what's our question?
Yeah, go ahead.
So someone from our email thread earlier this week asked, what are some potential long-term consequences of not making changes?
Yeah, I think that it's just like when you have a check engine light that's on in your car. If you just ignore it, the longer it goes on, the harder it is to fix the problem. And so, unfortunately, with our body, just like our body learns how to fire the right muscles at the right patterns to ride a bike, the longer you deal with pain, the better your body is at having pain. That's a real thing. And so the longer you deal with pain and just ignore it and go on, oftentimes it can become a bigger problem and harder to fix, particularly if there are contributing factors outside of just the positions that you're in for a long period of time. And so that would be the biggest thing, is just more persistent pain, takes longer to get better, need more medical help. Because often, like this girl here, she was able to get better quickly because she hadn't been dealing with it for an extremely long time. And she finally
and it was
figured out the
intermittent,
solution.
and because one of the things with her is like her positioning was only a very specific time of day. So the symptoms were, very isolated. Whereas if you're dealing with somebody who's cut hair, or dental hygienist, or you've had this very like repetitive job, or you work in an office, like so many of the patients we see, like they're doing this 8 hours plus a day. And then they go home, so they're reading. And so it's like you get, when I get someone, I get certain age groups, I do profile, because that if it's a retired gal that's at home and she just retired from this office job and she likes to read, and she starts having some radiating pain down her arm and neck and headaches, I usually first question I ask is, when did you get your iPad, or what book are you reading? Because it's usually a position that they've gotten into that they recently started, where they're just sitting there reading every night in this position, and their hands going numb every now and then because you're basically stretching nerves. It's very simple, but that goes back to your check engine analogy. It's like our body, when you really get good at understanding symptoms, it's like you need some tire pressure. Like my gauges on my vehicle tell me I've got my right rear tire is about 2 PSI low. Well, I can pull over now and go fix that, or I can ignore it forever. And if I ignore it for a while, I'll probably have a small leak. Eventually, I'll probably wear the tread a little differently on that side. Maybe I'll mess up my alignment. It eventually, over time, there's these small, subtle changes that happen until one day you wake up and you can't tie your shoe anymore. It's crazy. It's like, what point, how many patients do we have when you're like checking the range of motion, and like really good, and they're like, oh yeah, I can't turn my head to the right.
Well, you've helped me, Dr. Lott, because I've had a low tire for a week, and I'm going to go get that taken care of.
Hey, got to get it
if
fixed.
You change nobody else's life.
Pain will
mine.
peripheralize,
That's
right? Yeah.
So you talked a little bit about the person, we were talking earlier about activity modifications that will be helpful for individuals who are having neck pain or headaches. We talked about at the desk, make sure your screen's right in the right alignment, making sure your elbows are in a relaxed position, making sure you're sitting back and you're
not using your armrest all day. All those things are not horrible, but you just can't just rest on your arm, or you want to have numbness in your ulnar nerve.
But you didn't talk necessarily about those individuals who are on, reading at home, or maybe they've started knitting and they're looking down. Talk a little bit just about a few activity modifications that they could do, or position modifications, to allow them to keep doing that thing they love to do, but not have headaches.
Yeah, and I think that's a good point, because I think in the past my mistake was, I'm like, you shouldn't be reading that much. You should go exercise. Well, not everybody's going to do that. We need to, if you like to read, that's fine, read, but what you've got to do is figure out what are the most efficient ways to do that. So like I talked about the trailer analogy earlier. Like if you have too much weight forward, if my head's forward, I've got this 10 to 15 pound noggin that my upper traps and muscles are going to have to hold, right? And then if I have a book that or an iPad or whatever you're reading, I'm starting to really overactivate these muscles. So it just makes sense that after about 15, 20 minutes, you're going to have a little tension. You're focused on reading, so your brain's not processing that or listening to your check engine light. And you do that for 3 hours every evening. Eventually that builds into some kind of neck pain, right? So the simple solution is maybe to lean back, get some pillows. I would say support your hands and your reading device.
So you're saying maybe put some pillows up under your elbows to bring that.
Find the chair that you like and then just grab you 2 or 3 pillows, rest your book on it. Make sure your head's more in an upright position, because if I'm here, I'm rested, I got pillows here, and I'm just able to flip this book or scroll my fire, whatever, that stuff. But if I'm here, now this is gonna hurt, okay? And that's the thing, is like people think when I have a headache, there's nothing I can be done about it. It's simple. Most headaches, unless you have migraines and other triggering factors like that, they're usually extremely simple to resolve, but it takes you making some changes.
Ask why, be curious.
Yeah, like when you wake up and your head hurts, like what did I do different yesterday? So I think we have another question.
Yeah, so somebody else asked, what specific exercises can they do to combat those neck pain triggers?
I'll say what I think, and then you jump in too. But so I think that a lot of times, like I get that question a lot of like when I'm at the restaurant or somewhere, especially in a small town like Fairfield where everybody knows me. It's like, hey, Dr. Lott, what's the best back exercise or what's the best neck exercise? I'm like, it's the one, I think the best exercise for you is the one you can't do very well right now. It's like, to me, it's as simple as like, find the movement that you can't do, and then we need to work on doing that, because I'm a big believer in there's 3 phases of rehab or recovery. It's pain phase. We have the injury or we have an overuse. We protect it, right? And that's like that limp you're talking about. 2 or 3 weeks of limping. Like I need to unload that. Maybe I get a cane or walker, but I find some way to compensate. But we need to start moving into mobility phase at some point. And so what is mobility phase? Mobility phase is like, I need to be able to move my neck in all ranges, rotation, flexion, extension, side bending. Like you should be able to move your neck within a relatively functional range of motion without pain at end range, right? Now, it doesn't mean if we have a little arthritis and we're 60 and up, like that's normal to have a little in range discomfort, but you should be able to do a few and go, oh, it feels better now. It kind of goes back to that patient that says, well, I haven't been able to move my head, turn my head right for the last 10 years. Like, why aren't you concerned about that? Like, you need to fix that. Like, come see us, we'll help you. Or what you could do is realize, like, I've been watching the TV that's on the left side here for the last 10 years and reading my book, and maybe I just haven't worked this way. So it's a lot of times it's a matter of finding, to me, the best exercise is the exercise that is going to recover the mobility that you've lost, right? So if that is stiff and that feels good, I'm going to probably do more of this or this. So,
well, and one thing I would say is, you mentioned what's the best exercise. One, the best exercise is the one you'll keep doing. Because if you're like, hey, that exercise looks really cool or looks really helpful, but you don't do it, it's not very helpful. But the second thing I would say, going back to our check engine light analogy, unless you know something about cars, you're probably not going to go and try to figure it out on your own. You're probably going to go ask a mechanic to help you figure out why your check engine light's on, right? So like, I'm going to go to somebody I know and trust that's a mechanic and ask, why is my check engine light on? They're going to help me figure out the solution, because ultimately that's going to be the most efficient way possible. Now, what I will say, with that said, that'd be my number one, recommendation. But the second thing is, a lot of us spend the majority of our day in a seated, more flex position. And so like you mentioned earlier, and I had a guy that I've been working with, and he drove a tractor for the last 50 years of his career, and he looked over his right shoulder watching what he was pulling. And so he has incredible right cervical mobility, rotator, but he is stiff looking to the left. So the point being, for us that don't spend all day driving a tractor looking behind us, we spend all day in a seated position at a desk, we're more likely to get stiff and have harder time with our upper back and extending. And so if nothing else, if your neck's bothering, you're having headaches, you don't know which neck exercise to do, working on your upper back mobility is going to be extremely helpful. Even something as simple as having your hands behind your head, leaning back over a chair that's the back comes up to your mid back. Even that can be as simple as that is, it can be extremely helpful. But that would be my probably biggest recommendation is one, get somebody you know and trust to help you. We'd love to be that person, but if you don't live in this area, there's a lot of really great physical therapists. Number two, if you are someone who is having neck pain, headaches, definitely find that area of stiffness that you need to work on. Certainly work on that, but also just work on your upper back mobility, and it can be extremely helpful. So Sophie, our helpful marketing assistant, just gave me the sign that it's time to start wrapping up.
We just got started.
We just got started. Yeah, we're just getting Dr. Lott warmed up. So, but we do appreciate you being here, and I'm very thankful for just the opportunity to talk about neck pain and headaches. And there's a lot more questions that we could get to.
And if you have more questions, you'll post it. Then we love talking about this stuff.
Yeah,
I that's why they have to control me, because I'll go on and on and on. We love seeing patients that come in with having these issues. And as you can probably tell by listening to this, we love educating people. Our goal is to help you understand your body better and understand how those check engine lights come on so that you don't need us anymore. I mean, that's not a great business model, but we've said that for many years. Like, I want to teach you how to fix yourself. And it can be so simple, particularly especially in those unknown causes that pop on, like no injury, no trauma, like that's just a position. You're doing something different. We got to let's get through the weeds and figure out what started this little volcano of pain. And once we figure that out, we'll help you get some mobility back, get your range of motion, because we're so taught to protect against pain. Like, you go to the doctor, well, if it hurts, don't do it. And we spend a lifetime protecting. And when you do that, you develop these protective strategies and you can't raise this arm up anymore. And, he was mentioning that, I'm wrapping it up, I will shut up. But the thoracic mobility, I think, is huge for the neck and I want you guys to try this if anybody's watching right now, is like when you're humped over, try to raise your arm as high as you can. Like, you'll find it's a block. But if you sit up tall, pull your shoulder blades back, all of a sudden everything gets easy. So the thoracic spine has a big connection to the cervical spine. You get that better, moving good, and a lot of times you'll find headaches and neck pain really clear up easy.
So what I will say as we wrap up is what you do today lays the foundation for what you're able to do tomorrow. We oftentimes overestimate what we can do in a day, in a week, but we underestimate what we can do in this coming month. And so my encouragement to you is, if you have that check engine light on, do something about it now. Don't wait, because if you don't do anything about it now, it's unlikely to take care of itself, and you're going to be wishing you had done it later on. So if we could be helpful at all, please post any comments or questions on our social media. We'd be happy to get to those. Thank you so much.